Yeah, change, right? That's the theme of the season this year. First, welcome. Good morning. Glad to have you all at our event. I want to particularly welcome, all of you that have come to us from, our membership. So our self-funded employers, their advisors, our providers that are in the room. We've got other industry partners that support those folks. And our board of directors is here today. So I want to thank you all for joining us and for this very important conversation, and also for the support today, but the support you've provided us all year long. We couldn't do what we do without you. Appreciate your willingness to collaborate. And today we're going to talk a little bit more about not just ideas, right? Last year we talked about ideas, and all of us have ideas, but how do you change those ideas into action? So we're going to talk today about what we are going to do, actions we are going to take in order to make change happen. And so you'll feel, I think, that momentum today, and I'm excited to have your participation in that element. Also want to thank the folks that joined us yesterday. We had some kickoff events for some of us yesterday. An awesome opportunity for us to learn from each other, get to know each other a little bit better. Some of us got to know each other a lot better. We were downstairs in the basement of the Madison Club for the tornado room, right, the tornado alarm. We were all, kind of packed into this place with not a lot of oxygen, a lot of heat. Does that sound like the places you work? The healthcare industry overall? Yeah. But we all survived it. We're here today, and so I'm glad that we can all be together to take on the day's activities. So really appreciate that. All right, so now we're going to talk about the topic that we approached last year, bend the trend. Right? And this specifically has to do with the costs, right? And for us at the Alliance, this wasn't just an annual theme, but this was rather a commitment, right? So how are we going to every day figure out how we're going to bend the trend? And we challenged our employees, hey, every time you're interacting with the healthcare system, you've got a choice to go left or right. That'll either decrease the cost of healthcare or increase the cost of our health plan. What are you going to do? And that's not to say that you shouldn't interact. We want you to interact with the health system, but where you can and when you can, make a decision, make a choice, because it matters where you go. And then we're just recognizing that overall the trajectory still isn't where we need it to be, right? Healthcare costs are still going up, and we need to do something different if we're going to make a change happen. And so we'll talk a little bit about what we think those changes are going to look like, because where we're headed is certainly not acceptable. So specifically, getting into this per member per month understanding, we've taken a focus at the Alliance of making that a target for every one of our employees. We all understand it. We all know that that's what we're trying to accomplish. And I want to share that with you, our wider audience, because you all are going to be making decisions within your benefit plans, the way you educate your employees, the offerings that they are willing to participate in that are going to help reduce that spend. The truth is the Alliance can't do this on our own. We've got to do this with your help, with your participation. And frankly, it's the employers ultimately and the employees that are spending those hard-earned dollars that are going to help us to reduce that per member per month spend. And the unfortunate truth right now is that it's been decades, right, that healthcare costs have gone up higher than wages. And healthcare costs have gone up greater than our companies can grow. And frankly, they've gone up even higher than inflation itself. So to give you an image of what this looks like, I wanted to keep it super simple. So take a look at this. I'm a simple guy. I understand simple math. So take a look at where we were in the 1950s. So this is a demonstration of GDP. So 1 out of every $20 went to healthcare back in the 50s. Right? Reasonable, expensive but reasonable. What has happened fast forward to 2026? And where are we with healthcare spend? 4x. 4x and no end in sight. 1 out of every 5 of the dollars in your wallet goes to healthcare. Does anybody carry cash in their wallet anymore? Some of you? You got 5 singles in there? Pull out one of those singles and put it on the table. There's your, right? That's your visual. 1 in every $5 goes to healthcare. That doesn't work. And we can do better. And we're going to figure that out together. And the bigger reason that I'm interested in this, not only is this an economic issue, not only is this an issue for the sustainability of our economy and for the businesses that you all run, but this is a big deal for our legacy. right? The truth of the matter is we have allowed this to happen. All of us in the room have been part of living in this country with this health system, and we're handing this issue off to the next generation that they didn't create. I've got 3 boys that are entering the workforce. I'm concerned for their future. I want to fix this for them. I'm sure all of you would feel the same way. If you were to think about who's most important to me, who do I want to go to work for every day, close your eyes and think about that, your family image comes to mind. All of us do. So how are we going to shape the future of our healthcare system? Not for them, for us, which will impact them. So the other issue that's come to mind as I've contemplated this, right? I'm to the point in my career where I've seen a bunch. Blaming the other guy hasn't worked, but it's easy to do, right? It's not our organization's problem. We're the good guys. We're the ones trying to fix this thing. This certainly is, it's the hospitals, right? They're the guys that are causing all of our issues, right? That's the problem. No, it's the employers that aren't active enough, educating their employees. If only they were to do more, right, we'd be further along. It's the insurers. Those guys don't get it. Everything that they do, it benefits them. They don't benefit anybody else. It's the regulators. If only we had better health policy, we'd figure this out. Does this sound familiar to anybody in the room? Some of us? Yeah. What I've come to understand is pointing fingers hasn't gotten us very far. It hadn't gotten us very far at all. We saw it. So my question for us, my challenge for us, is how are we going to get on the same side of the table? How are we going to work with the providers? How are we going to work with the TPAs and the stop-loss carriers and the advisors? Realize that the problem isn't them, it's us. And the only way we're going to solve this issue is by linking arms together, identifying the problems, creating the solutions, and executing those solutions together. Can I get a little reply if you agree? I get excited about this stuff. And I apologize for that, but I don't apologize for the work that we're going to do, because honestly, it's going to help all of us and the generations that we care a lot about. So let's talk a little bit more then about a new way of working together. So the truth is, together, we can disrupt the cycle. We can do things differently. And in order for us to drive that meaningful change, as I said, it's not any one of us that's going to tackle this thing. It's not any one of our organizations that are going to tackle this thing. Many of you would say, I'm doing really good work, or my organization is doing really good work. I would agree with you. But I want you to think differently. It's not just how good are you at your craft, it's how good are you at enabling the value chain of the healthcare supply and payment to be elevated so that we can reduce the cost for everybody. So it's not good enough just to be good in your own lane. You've got to be good in contributing your efforts, your talents, right, to the greater good here, so that all of us can benefit from bringing the healthcare costs down. And it's not by thinking that we know all of the answers. A lot of you guys are really smart. You've been around the block a few times. But to get to where we need to go isn't by having the answers, it's by having the questions. Why aren't we where we should be? What if I were to do something different, right? So let's think about the questions, that we are looking for. Because along with our experience come biases. We think we've heard it all before. Oh, we tried that. That won't work. Oh, I've talked to that guy. He's a roadblock. He'll never go for this. How many of us think that we've actually killed ideas within our organizations by saying, hey, we've tried that. Yeah, that's not going to work. Have anybody heard that conversation? Yeah. How many awesome ideas will never see the day of light because we killed them in that conversation? Oh, don't worry about it. We tried that. Don't worry about that. Oh, I don't know if that's going to work, or that guy's going to stop it. Let's think differently. Let's think differently about how we can ask the right questions, challenge each other, right, so that we can think differently about how the healthcare solutions that we are going to create together can be implemented. And let's be willing to learn from one another. Stop defending positions, seek to understand, challenge one another with healthy curiosity. So that brings us to a different mindset, right? a way of looking at the world differently. So what I'd like you to do is create your learner mindset today. Let's get into it right now in the moment. And rather than us being a know-it-all, let's be a learn-it-all. Some of you have heard from Satya Nadella, the guy that runs Microsoft. That's his phrase. I love it. I don't want to hire know-it-alls. I want to hire learn-it-alls. The healthcare industry is way too complex for any one of us to know everything. So let's make certain that we are working collaboratively, that we're creating a new perspective on how we can innovate together. So are these ideas worth pursuing? Why would we bother to do this? Kurt, it's great. It sounds awesome. You want us to think and do things differently, but do ideas really materialize in change? The good news is yes. Yes, and some of the things that we talked about last year have already started to happen. And I know that some of you in the room have participated with us in making these things come to life. So we are focusing on value and not just price. We do have employers thinking like that. We do have providers thinking like that. We have expanded access to providers who deliver better outcomes at a lower cost. We're giving employers better data so that they can make better insights. Some of us using those AI tools, yeah. We are thinking about doing the same thing. Data is going to be king. We're going to have to make certain that we can deliver on that, and we already are. We've aligned incentives to do the right thing for the patient that also works for the provider. Let me say that one again. We've designed ways that work for the patient and for the provider, right? Because we need the providers to be healthy in order for us to have an ecosystem that works for all of us. So these are all meaningful shifts, right? And I want to thank those in the room that have made those things come to life. I really appreciate it. It's awesome work. But it's not enough. And we can do better. And we're going to talk about ways that we're going to get that done today. So my challenge for us is to come with an open mind, think about how we can approach healthcare differently. We're going to experiment a little bit today, and I want you to use this philosophy of yes and when you're talking to people. That's a great idea. And on top of that, what if we were to do this? Right? Keep those positive vibes going. And I'm going to say that we have an opportunity, but in my case, an obligation to accelerate our efforts. We got to work faster, guys. These changes are happening at a rapid pace, right? And the external environment is changing weekly. So if we can't keep up with it within our organizations, it's going to influence us more than we're going to influence it. So we've got to work fast. Now's the time. Today's the day. We've got to get moving. And we're going to be uncomfortable. And it's okay being uncomfortable. But we're going to attack issues, not organizations, not people. But we're going to go after the issues, and we're going to go after the issues vigorously, right? Unabashedly, so that we can make real change happen together. And I think you're going to be surprised by what we can accomplish when we put the mindset and the experience of this room to work on those issues. So together, we're going to build a healthcare system that delivers real value. It's not just the per member per month. It's not just hey, let's do this for the next generation or the next annual renewal. But let's do this for the next generation. Let's do this for our kids and grandkids. Let's do this for our nieces and nephews, for those of you that don't have kids, right? These are the folks that are depending on us to get this right. We've got to get it right because they're depending on us to make this happen. And the change can happen here in Wisconsin. And it will happen here in Wisconsin. So, we'll go back to this slide. I started my comments with this slide. And then we've covered a lot of ground. Do you view this image differently than the first time you saw it? Through the sense of collaboration, right? You see a bunch of folks now working on this together. There's no one set of folks working on this together. Because this isn't going to be just a set of ideas, but it's going to be a movement. It's going to be a movement. When all of us start working together, winners attract winners. As we start to stack up our wins, we will attract more to this movement, to the work that we are doing, and with that movement momentum will come additional power, and we will watch more change happen. The fact is we can do something, and we will do something. And I'm looking forward to it. So we're going to test those ideas out today. We're going to try those ideas, and we're going to make certain that we make commitments to one another, that we're going to make something happen here over the next 12 months, and I'm excited to talk to you about ways that we're going to get that done.